I know you're joining us from Saibai Island. Appreciate your time. I know you're on the ground there rolling out vaccinations to locals. You're just kilometres away from Papua New Guinea, which, as we've been reporting, is struggling to contain that COVID outbreak. Just how serious is the risk to Saibai and also to the rest of the country, with Saibai, the fear being that it could be an entry point for COVID to Australia?
Yeah, good morning. Thank you for having me on. The increased risk from Papua New Guinea as a potential entry source for coronavirus in Australia has been long recognised and has been long mitigated by state and federal government processes, which has kept this region very safe. We still have 0 cases across the Torres Strait and Cape York of coronavirus, which is a marvellous achievement for local communities. It speaks to the testament of the provisions put in place to help protect these vulnerable regions. The geographical nature or the proximity to Papua New Guinea of the northern Torres Strait Islands, particularly Saibai, Boigu and Dauan are the 3 in that group, mean that there is obviously increased risk of transmission were there to be human movement. That's been the reason state and federal governments have mandated the rollout of the AstraZeneca to these regions first, and that's been great for us to be able to have access to and help protect these communities. We're seeing increased concerns in the media around Papua New Guinea, and they've obviously got their outbreak and crisis underway. Australia's providing what support they can to that, and they're doing a good job, we think. Here on Saibai, we've come in with our vaccination team, which includes health workers, nurses, who are the primary leaders of any vaccination program. I'm here to help support from the back end as the medical officer. We've acknowledged the traditional owners of the land and had a great community meeting around the risks, pros, cons, and benefits of receiving the vaccine. People have been coming in very good numbers, and we've been offering the vaccine to everybody over the age of 18. I apologise, there's a helicopter taking off in the background here. It's been great to see the community come in and ask really good questions so that they can provide informed consent for the vaccine. A lot of those discussions have been around the things you've been discussing on your program, and they're the risks around the side effects or potential side effects within the media at the moment, and on the product disclosure information of getting the vaccine. So lots of conversations going on, lots of explaining to people the risks in the evidence behind concerns that they may have, and then they're free to make their choice about whether they have the vaccine or not. And we're seeing really good engagement from those people and a good high uptake and acceptance of the vaccine. It's very positive to see.
So just how many people have been vaccinated there so far, and how vulnerable is that community of Saibai and also more broadly through the Torres Strait to COVID?
So there's approximately 200 people over the age of 18 who live on this island and are here at the moment. We've done over 130 or 140 vaccines so far, which is marvellous. So we're looking at a high percentage rate of people, and we've still got another day and a half of this program to go. Very encouraging and led by the engagement the health workers locally here have done with community, and great representation from the councillor as well. The people living in the Torres Strait have been aware of the risk of transmission of COVID, both from within the rest of mainland Australia and also from Papua New Guinea throughout this pandemic. As I said, they've done a really good job of helping mitigate that risk and very community feel for protecting and making sure that everybody is safe from coronavirus. You asked about the vulnerability of communities like this, and the vulnerabilities in all remote Indigenous communities and most of remote Australia is reflected in a higher chronic disease and morbidity rate. People suffer a lot more, higher percentages of people with chronic diseases in the remote regions, and particularly in Indigenous communities. They also suffer much earlier median death age, so they have a much lower life expectancy if you live outside the capital city. The Australian Institute on Health and Welfare will reflect those stats at just a cursory glance at their website for anyone who'd like to go on and have a look. We do know that coronavirus, if transmitted in communities where there's high rates of chronic disease, suffer more morbidity, more hospitalisation and more death. For that reason, it's very important that these communities are helped protected from transmission of COVID entering their communities, but also offered early opportunity if they wish to get the vaccine to help protect themselves and their communities. And we've seen great uptake here because I think people do understand that risk. There are high rates of chronic diseases here, and even those who are well and young and healthy are aware that they play a role in making a ring of protection around those they love who may have those chronic diseases. And that's been marvellous to see from this community. We're looking forward to going to the other communities next week in Dauan and Boigu and offering the same. And we encourage everybody to come on in, ask all the questions they want to. That's what we're there for, to answer them, to help support and help provide the vaccine if they wish to have it.
Dr. Marlow Coates, keep up the good work. Best of luck for the rollout as you continue that over the coming days and weeks in the region. Appreciate you taking the time to speak with us.
Thank you. And I'd like to thank all the local communities for engaging so well and all the health workers for helping with that engagement, along with councillors involved. Very important to get behind this initiative. Thank you.
Dr. Coates, thank you.